Okay, it looks like we're live on the broadcast. Welcome, Sadaf. I'm so excited to be interviewing you today. Let's see. I'm hoping that Hangouts will switch the camera back and forth as we talk. I'm a little new to Hangouts on air. So hello to all the listeners who are joining us in YouTube later and who may be joining us live. I'm here interviewing Dr. Sadaf. Oh, how do you say your last name, Sadaf?
Ulde.
Dr. Sadaf Ulde of Mumbai. And Sadaf is somebody I just love so much. She's a wonderful being, great spirit, and a very accomplished doctor and teacher in homeopathy. So I'll just tell you a little more about her. Sadaf, since graduating as a medical homeopath, so you're also a doctor, in 2009, you've been associated with the Mumbai Homeopathic Study Circle for the development of Mumbai homeopaths, part of the Ayush program of homeopathy for mother and child care. And you've been working at the Other Song International Academy as a resident doctor and faculty. And Sadaf has been teaching for 3 years. She has been a close assistant of the very well-known doctor who is famous for working with cancer using homeopathy. And she's also had the opportunity to work and study with Dr. Mahesh Gandhi, who is at the forefront of psychiatric care using homeopathy. Now, one thing I want to tell you, American viewers, is that in India, homeopathy is very well accepted, and it is considered, it is one of the main medical branches. So almost all, you can correct me if I don't get this right, Sadaf, but almost in India are also medical doctors. They have the full background, yeah. So and Sadaf also sees clients from the US potentially, and on Skype when she's back in Mumbai. And Sadaf, I know you're staying here for several months because you have a new, is it a niece or nephew? You have a new baby.
Nephew.
In your life, and nephew.
Yeah.
And so you're with us here in California for a little bit, which is fantastic, and that makes it a little easier to do this interview. So one of my missions here, so let me just mention a little bit about myself. I am Oonagh Taeger, also a homeopath. I help children and adults who struggle with autoimmune disease, allergy, and other chronic disease to rebuild their immune systems so they can live more joyful and productive lives. So it's very much part of my mission to spread the word about what homeopathy can do for people. Because, when we get a label of chronic disease here in the US, it comes with an understanding that this is something that you're stuck with, that can't really be healed, that you can just manage with conventional medicine, with pharmaceutical drugs. Now, sometimes that's true to some extent, but actually, a lot of healing is possible. And the reason I asked Sadaf here today to talk with us is because I know she has many stories of seeing people heal fully from chronic disease, including serious autoimmune disease like MS or diabetes or as a whole host of things that you're going to be able to tell us about. So we're just going to share. So I'd like to ask you to share some stories from that you've seen in practice at the Other Song clinic in your practice. Yeah. So
Okay.
So do you want to what can you just tell us maybe a little bit about how you work with chronic disease and autoimmune disease and serious things like that with homeopathy in India?
Okay. So the first and foremost thing is, for any disease in homeopathy, the first principle that we follow is that we are treating not a disease but a patient in total. Hello?
Yes, yes. Very
You
good. I
there,
got
Mira?
that.
Yeah. Actually, the
Yeah,
video got still.
yeah. So you're treating the patient
Yes.
in totality and not
In
just the
totality,
disease.
like
Yes.
the famous saying, there are doctors for the body, there's doctors for mind, but a real healer is when there's doctors healing both body and mind. Okay,
Yes.
so
Yes.
homeopathy with this principle tries to understand an individual in total. Okay, whether it's their disease, whether it's their mind process, or it's their spiritual being,
Yes.
which in turn kinds of raises the healer within. Every human body has a power to heal itself. Okay, we have our immune system, okay, which is ready to fight any illnesses. Unlike other school, where if suppose your diabetes is 300, they'll give you some medicine, bring it to 130. Okay, whereas in homeopathy, the body will fight the high raised blood sugar levels to bring it back to normal. Okay, so it's like you're stimulating the healer within yourself. Okay,
I,
everybody
yeah.
has the potential to heal whatsoever possible with its own IQ. Okay, so
Yes.
which is hampered otherwise with other line of treatment, with vaccinations, with antibiotics and all anti-diabetic drugs, chemotherapy. Whereas with homeopathy, we stimulate this healer, and the whole life of the patient changes from physical as well as emotional being. So this is the basic philosophy of homeopathy. So the first and foremost important is we understand the patient through the case taking. If you go to any of the homeopathic doctors, the first thing they'll hand over is a big case record form. Okay,
Yes.
it's a big questionnaire. So often my patients will be like, "Oh my God, what are you doing?" It's like in back in India, we have something known as kundali, okay, which is like an astronomical thing. So they are like, "Are you asking for a kundli out of us?" Okay, but it's not like that. Okay, it's it's from the beginning. Okay, we try to understand with this help of case record form, like how the disease has developed, how it has manifested. So most of us stalwarts have told this as diathesis. Okay, so like if you have asked me to tell me about a lot of history,
Yes.
stories, right? Stories. So just
Yes.
going back to the stories, we have this. I remember this case of uterine cancer. Okay, she was scheduled for
Yes.
an urgent surgery, 2 days next to
Mm.
her appointment. So we started with the history, and we discovered that this female had an injury. Okay, she was absolutely in perfect health. She met with an injury and she was operated. Okay,
Mm.
followed by which she had a hip joint injury. Operation was done, but this operation did not heal her. Instead, there was a
Ah.
lot of sepsis that had formed. But then, with the conventional treatment, they gave her a lot of treatment. She was healed. But immediately within 6 months span, she discovered that she had breast cancer.
So she had sepsis in her abdomen after the hip surgery. She
Yes,
had been in perfect health till her
yes.
injury. And
And
then she treated with antibiotics, and it seemed like it was all better, right? Like we
yes, it
think,
seemed like,
oh,
yeah.
yeah, it seems like conventional medicine, it seems to work. It
Yes,
seems that, okay, the antibiotics must have taken care of this.
yes,
But somehow, 6 months later, a previously healthy woman has breast cancer. So this is very interesting because
yeah,
there's a link here that the normal doctors wouldn't make. But in
yes,
India, you are making this link, and
yes.
it's going to help you be able to cure her.
Yes. Then further, going on with the story, the breast cancer was treated with chemotherapy, radiation, surgery as per the protocol of allopathic or the conventional medicine, followed
Yes.
by which immediately after, the doctor said, okay, now she's fine. She has no need to worry about. But within a year, she discovered a vaginal bleeding,
Mm.
and the vaginal bleeding was massive. So they went for investigation, and they found that now the cancer has actually metastasized to her uterine
Mm.
and
Yes.
also to the bones. So the doctor said is removing up the uterus, okay,
Mm.
throwing it off. So this patient actually met Dr. Meghna at her swimming classes, and he said, "Can I try with homeopathy if something can happen? Because allopathic doctors have just given up hope." So he said, "Fine, you come to other song. We'll see what can be done." And we started the treatment under Dr. Sujit Chatterjee, myself. We both first intake, I did the case. And when I started taking the case, obviously I discovered this facts, which in homeopathy we say past history. Okay?
Yes.
And the family history. Okay, so in family history, there was a meager evidence of cancer, but not that dominant. Further on, I discovered whatever, like you can understand, she has a traumatic hip, she had breast cancer, she had uterine cancer. Despite of all this, when I'll ask her, what are your complaints? She'll be like, I'm absolutely fine, doctor.
Oh, how strange.
Yeah. So it's like this is something unique. I've seen cancer patients shrieking, they yell, they shout, they are bad with us, in a bad mood. And she has a uterine cancer, which obviously has also taken a toll with the hormones of her, but yet she's so calm. So
Wow.
yeah, so whatever we would provoke into her, she will just say, "Oh, I'm okay, doctor." And the relative confirmed that even when the difficult surgery was going on, she didn't even do ooh ah ouch.
Wow. I
Okay?
have a feeling I have a little suspicion of what remedy you're gonna say helped her, but I'm
You
gonna
can
keep
get
my mouth shut. I
okay,
have a
okay.
little guess of, what family. And I think it's a plant family.
Yeah, that's
I
true.
think
That's
it's
right.
going,
Yeah.
yes, I think it's going to be the Asteraceae. I think it's
Yes.
good. Yeah,
Yes.
they come, yeah.
Yes. So
I'll
this
let you
was
explain.
yeah, this was very interesting phenomenon that was going on throughout the case. Like anywhere, it was a whole picture of being completely contented. Okay,
Wow.
so we were wow, this is something different. Normally, with the history of cancer, we have a lot of grief hidden. We have something or the other which is going on in the emotion. But in our case,
Yeah,
it was like absolutely normal, no
yeah,
pain. She was on wheelchair, but she was like no pain. So I took the case to Dr. Sujit, and we were like, okay, so this case is very strange. The whole patient appearance is like she's completely satisfied.
yeah,
So like you must have guessed by now, he said no, we'll still, so I was like, we'll still try and provoke if we can get something, but more or less nothing could come up except a long history of injury. Okay, so
yes,
never well since an injury. Okay,
yes,
ailments after operation. So you see, in this case, we picked up the causative factor and the past history factor. Okay, so
yes, yes,
understanding this and her overall nature, where she's saying, "I'm absolutely fine. I'm absolutely fine." The state of bliss, or says well when sick. Okay,
yes,
yes, that was the rubric we considered. And the whole miasm, okay, that's the cancer miasm that we found, that
yes,
she is too much in control of her emotions.
yes,
So, you see, it's not just the mind, but also the physical, plus the progress of the disease that we took care of, and the remedy we came up to is Bellispur.
yes.
Yes,
So a
yeah.
daisy,
Yes, Daisy.
right?
So
Yes,
with Wellspur, if you go and read, even in the herbal medicines, if you don't consider homeopathy, just the herbal or the Ayurvedic use, it had been used as a remedy a lot for injury, for railroad injury.
yes,
Yes, and this
that's
is
right.
also operation surgery is also a kind of an injury to the human body. So when
Yes,
the remedy was given to her, there was a beautiful change in her. Okay, then over a period of time, to get over with the miasmatic block, we gave her carcinosin. Okay,
yes,
carcinosin co. Okay, which means there are carcinosin made of only breast tissues, there's carcinosin made of uterine tissues, but carcinosin co is made up of different tissues. Okay.
Yeah, let me just say for our audience who doesn't know, carcinosin is a remedy that is made from cancer tissue. And so there's no cancer tissue in it. It's just, it is a homeopathic remedy. It's just energy. But what it does is help clear the system, clear the energy of the person from the tendency to cancer that has been inherited. So it actually has like a genetic effect, that it's
Yes.
helping to change that gene expression that was passed down in our family, so that it lessens our tendency, it lessens our susceptibility to cancer.
Yeah. So you would believe after the remedy, so this patient was scheduled for a surgery. Okay. Just 2 days
Yes.
after, the patient called up the surgeon and cancelled her surgery.
Wow.
And in 3 months' time, the cancer in the uterine region showed regression.
Mm,
Okay. And now
that's
she
beautiful.
keeps coming off and on. She will have some acutes, which we will give an acute homeopathic remedy as and when that was indicated. Mostly she was
Yeah.
kept on the same remedy and different potencies. And now it's
Hmm.
almost been a year. I don't know if I can show you her picture. She has
No, I
made
don't
a
think so.
family picture with the whole family and she sent it to me
Oh.
saying, hey, Dr. Sadaf, I've been missing you. So the whole
Uh,
family gathered and eventually that whole family transitioned. So another story to add on was of her sister-in-law.
mhm.
So
Wait, I missed a little bit there. Can you say one more time what
the whole
happened?
family, the whole family eventually became a patient.
It
And
became
one,
vacant.
yeah, and one of the dramatic cases of her sister-in-law.
No, let me, before you tell, is the sister-in-law another case?
Yes,
Before,
yes,
let me I want to pause you because I want
yes,
to talk about a couple of things that you mentioned that are so interesting that the audience might not understand.
yes,
That are just so beautiful about homeopathy. Now, you talked about how we, in homeopathy, we are treating the whole person, body, mind, spirit. So we are looking at the emotions, and we're looking now when a medical doctor, a regular conventional medical doctor is diagnosing, they are just looking at what's common to that disease.
yes,
Oh, it's cancer. It's in the uterus. This is how we label box we put this case into. But you are looking at what's different
yes,
about that person, because that will tell you about her, how she is having cancer, what's
yes,
unique. So that will tell you the unique remedy she needs to heal that cancer. You can't just give some remedy for cancer. You can't just give
exactly.
the carcinosin. You
Yes,
have to find that what's special about her. How is she? What does this disease really mean to her and her system? So you saw one very strange thing about her, which was
yes,
that she was saying, "I'm totally fine. I have this uterine cancer, yeah, but I'm fine." And she just kept feeling like, "Oh, she's fine. There's no problem." And
yes,
you saw that is the theme that we know as homeopaths. We know that as part of the theme
yes, it's
of the
unlikely.
plant family. Yeah, it's one of the themes of the daisy family,
Yes,
of the Asteraceae
yes,
family. That
yes.
whole family has that theme. Even if they're very sick, they'll say, "Oh no, don't touch me. I'm fine. I'm well.
Yeah.
I don't want you to,
So this remedy Bellespur
don't."
belongs to Compositae. Hello?
Yeah, yeah.
Compositae family. So again, another important theme is injury of this family.
Injury, that's right. And
Yeah.
so that was also important, that her cancer, not
Yes.
just it was characteristic of her cancer, that it was caused by an injury. It came
Yes.
after an injury, and that is not true of all cancers. So
Yes.
you were able to put those things together to choose a very individualized remedy, and that allowed her to heal. Now, how much of her cancer is gone after 1 year? What state is she in now?
Right now, her PET scan shows that there is 60% reduction.
60%
Yes, and it's
reduction.
just 6 to 7 months. And
Yeah.
moreover, it's not at the cancer that we are looking for. Okay,
Hmm.
so that is another important aspect of homeopathy, where we just don't look at the disease only. we look
Yes.
about the overall picture. It's
Yes.
like you scan through the whole human being and see where and what the problem is. Okay, so
So,
in her case, for example, not only the cancer reduction became important, the most important thing, the general sense of well-being, which most often
yes.
after chemotherapy, radiation is completely gone.
Mm-hmm.
Okay, so like she has started eating well. You won't imagine, she has started doing yoga. She is
Mm.
around 70, 75, and she was completely on wheelchair when she came to us. She started doing yoga.
Wow. 75 years old.
Yes.
She's gone from being in a wheelchair to active, feeling good, and doing yoga.
Yes, doing
And
yoga. That's what we look for in homeopathy. It's
that's
not the
fantastic.
disease. We just don't
Yeah.
look at the report saying, okay, this was positive, this is negative.
Right.
And overall emotion. The husband said, the interesting thing he said in one of the follow is, do you know, all this year, my wife was very calm and quiet. Now she started fighting with me.
Yes, let me explain that a little bit, because some people might not think that's positive. But
Yes.
actually, in cancer, there's a lot of suppression of the feelings. And
Yes.
that's a general characteristic of cancer. So when we heal somebody with a cancer tendency, they become more able to express their
Express their
feelings.
emotions, yes.
Yeah.
And my husband was very happy because now she started asking for things. And he's like,
Mm.
all these years I used to just guess, okay, she might like this, she might not like this, but now she started to vocalize. So the whole thing
Wow.
of cancer begins with non-vocalization of grief or non-vocalization of emotion. So
Right.
when the right remedy clicks, it's not just the cancer that is taken care of, but it's the emotions, it's the physical general level, the vitality that has to shine. And then you're sure, okay, this is the right remedy, or yes, we are on the right track.
That is absolutely beautiful. And I mean, that's one of the things that made me fall in love with homeopathy. It's not about the disease, it's not
Yes.
only about healing. Of course, we want to heal the cancer, of course, we want her to be in great health. But it's about, really feeling well, really having a full expression of that life force. Now, here one other question I have for you,
Yeah.
because Americans will be wondering this. Here, people would be very nervous to miss that operation and
Mm.
to just rely on homeopathy.
Mm.
Why? Like, what's the view of that of doctors in India? Why were you comfortable with her? What do you? Why did she cancel that? Why didn't she just have the cancerous uterus
Okay,
removed?
yeah. See, now the first thing, okay, is whether the conventional line of treatment, especially in cases like cancer, should we stop chemotherapy, radiation, and surgery? Okay, this is the first question. So,
Yes.
more or less in India, what we do is we leave it open to the patient. If they want to go in for chemotherapy, radiation, and surgery, it's their choice. They can, okay? If not, we also have remedies which can combat the side effects of the same.
Yes.
Okay, so we have certain remedies that can take care of side effects of chemotherapy, radiation. So there are various, like you have certain actinide group of medicines, you have certain homeopathic plant remedies, certain mineral remedies that can take care of this. So that's a choice. We keep it open for the patient. Okay.
Yes.
Another thing, back at other song, we have an oncologist now who's joined us. His name is Dr. Kulkarni. He's a radio oncologist who himself is not supporting radiation and chemotherapy.
Oh wow.
So if we have a doubt that okay, this patient is getting more of harm from chemotherapy than advantage, we refer it to him. Whether we shall go
Oh.
around with the chemotherapy or radiation, then he suggests, and it's basically both the parties, the conventional and the homeopathy coming together can do benefit. So we don't have
Yeah.
resistance towards the conventional medicine when it comes to cancer because whatever best done is less for this kind of an illness.
Yes.
So, if they want to do chemotherapy, radiation, the plight of the family and the patient, we allow them. Certain patients do benefit with this combination of chemotherapy, radiation, and homeopathy. Certain patients benefit only with homeopathy. Okay, like
Yes.
this patient had already gone through a lot of chemo, radiation, surgery, and she herself was tired of it. She knew
Yes.
that I'm only just 70, 75. How much more I'm going to live? Okay, so might
Yes.
as well I just live happily without this treatment. And to her surprise, it's more than her expectation that what she's getting. Okay, her
Yes.
cancer reverting, her general well-being coming back, and she feeling more younger or whatever, right? So that was her choice. So we don't force upon patients whether they have to take chemotherapy, radiation, or surgery. We keep it
That's
open.
very,
Yeah.
that's
But if
very
we see,
beautiful.
yeah, and if we see that, like I'll give you an example, just a short example. There was a patient who took along with homeopathy chemotherapy, and post that, after every chemotherapy, he will develop a lot of nausea. Not only nausea, he will hallucinate. Okay,
Hallucinate.
yeah, he will go into hallucinations, and he will really break up, and things will go haywire for himself and family. So we
Whoa.
had a lot of weakness that will drain them out. So we gave him some doses, like with Dr. Sujit sir. What he prefers giving is uranium nitricum or
Uranium
plutonium,
nitricum. Yeah.
uranium nitricum, plutonium nitricum, or metallicum in
Now,
200 potency.
let me just interrupt you because that hearing that you gave a remedy, uranium nitricum, plutonium nitricum, that will terrify the audience.
Oh, okay.
So we have to explain that these are so carefully
Yes.
diluted that they're diluted way beyond the point where there would be any actual radiation or radioactive matter in that remedy. That
Yes.
is not at all.
Yes.
It's only, all that is left is an energy signature of uranium, of
Yes.
plutonium. And the thing is that, you know, because the crude dose, the metals, do cause cancer, that
Yes.
actually for and they do cause radiation sickness symptoms, of course, that the remedy, the potentized remedy that's completely safe, will be able to cure radiation sickness
Yes.
and also sometimes be remedies for cancer.
And these remedies, moreover, are given in very minute doses. Okay, it's just like one dose. That also we ask them to mix it in water.
Mhm.
Okay, and then they take it, and it is very carefully administered. So if anybody randomly picks up this medicine, they might go haywire, they might cause the case to damage then to benefit. So best is that these medicines are given under supervision of a homeopathic doctor.
Yes,
Yeah.
it's so for those of you over here in the States, if you go to your Whole Foods or you go to your health food store to buy remedies, you will not purchase plutonium or
Yes.
uranium and self-administer it. This is
Yes.
just something to, when you're working with an expert who is, like yourself, like Dr. Chatterjee, who works with
Yes.
cancer, they will need to use these remedies because they have the power over to help with these
Yes.
problems.
And it's not only with these remedies. With respect to any homeopathic remedies, like most of the people, even in India, they
Hmm.
read on internet that okay, natromure is good for headaches.
Right.
Okay, and they will go up and take pop in pills of natromure, or they'll read lycopodium is good for acidity and gastric complaints. So they'll pop up
Mhm.
the remedies, which will do more of a harm because
Yeah.
it's not the exact remedy that your body wants. Okay,
Right.
it's always under the supervision of a doctor who can analyze your case, who can
Yeah.
take your case and look at you at a third perspective. You might,
Yeah.
nobody will think of the bad perspective of themselves or their relatives. So it's always the third person with a third eye who can, with an unprejudiced mind, look at the patient, his history, and then diagnose.
Yes.
I
Yes.
think
That's
it's
very
easier
important.
to take over-counter drugs of the conventional. Like you have headache, you go and take crocin or nimesulide or whatever.
Yeah.
But whereas in homeopathy, you need to be really, really supervised. Like for myself, I don't take
Hmm.
homeopathy on my own for myself. I
Hmm.
will always
Good.
go
Your
back to
health.
my I'll always go back to my seniors and I'll say, okay, you please take my case and give me something, right?
Yes.
Because it's
Yes.
not that easy, right? You will always have
Hmm.
to, you have to free your mind of prejudice. The way
Yeah, it's
you look
not.
at yourself may not necessarily be what you are really looking at, or your
That's right.
situation. So you have to have a third person perspective, unprejudiced perspective before administering any homeopathic remedy.
Yeah, I
So
think
one
that's really
advice to all the American viewers is please don't take homeopathy just over the counter unless
yeah,
it's
it's
like
true,
all the time Indian patient.
It's a good point. We do have some very good books for helping people prescribe for acutes at home. I
Yeah.
do, those I think are fine. And people who take the time to learn a little bit about how to do
Yes.
it, they can safely treat just like, colds and earaches and things at home. But but not by looking at what it says on the bottle and
Yes.
it
Not
says
on the
headache.
bottle. Yes.
Yeah. And
Yeah.
and also, it's very important for people to know that even if they're quite good at that, when it comes to your chronic issues, the ongoing things, or chronic disease, that's when you really need a professional to look
Yes.
very, really objectively at the totality of you from the outside, from an outside perspective, as you're saying. So, so you have, I know you have more stories for us. Let's do another story.
Yeah, so more stories. So I'll start with this sister-in-law story of this
Yes.
patient only. So this patient had cardiomyopathies developed. She was an asthmatic since her birth or since long years, and over a period of time, she developed hypertension, cardiomyopathies, and she landed up in ICU. Almost 2 times she landed up in the ICU with severe
Okay.
respiratory arrest.
Severe respiratory arrest in
Yes.
ICU, cardiomyopathy, and high blood pressure.
Yeah, high blood pressure, asthma in background. And
Mhm.
what happened was she was barely able to breathe. At
Mhm.
one point, the doctor said, we're just giving a last try. Maybe this is her last breath that she's going to take.
Oh my.
So this family had developed high hopes with homeopathy after the incidents of this mother of them. So they immediately
Yes.
called us like, we need an urgent appointment. We don't know anything. Patient cannot travel to Mumbai. They were in another state of India, that's New Delhi, which is like almost north is New Delhi and west is Maharashtra. It's a huge
Yeah.
long distance. So they said we cannot travel, she cannot take flight, she cannot come by train or anyway she cannot come to you. She's hospitalized. Do something and give her a medicine. So the teacher was like, how do we go about? So they said, okay, we'll do it on telephone, on not on Skype. Even Skype was not possible. So we said, fine, let's give it a try. We said, see, we cannot guarantee because it's a very short case taking that we are going to do. So let's give us some. But they were like, no, we are ready to take any amount of risk.
Now
So
tell me, how old is this lady?
she was around 60, 65 or
Okay.
same, yeah, same
That's
age group. And she was breathing heavily. So I called that patient up and I said, okay, you just look at the patient, okay, and tell me all that she's doing and how it has started or whatever. So they
yes.
said, okay, these are the illnesses she's been suffering. And since few days, what is happening is suddenly there is a kind of her air hunger. She cannot breathe. She
Mm.
feels suffocated. She cries. She feels as if she is going to die. Okay.
Mm.
So the first, like it is whether she's in between life and death. That's what they
Yeah.
said. Okay. And I said, what she does when she's in the attack. Now, this is another aspect of homeopathy. Homeopathic case taking, that is very important. Like in the first
Yes.
case was the causation. The second case is during the attack, what is happening. So
Yeah.
it can be anything. It can be a fever, it can be an epilepsy, it can be an asthmatic attack, heart attack, loose motions, or whatever. So what exactly the patient does during the attack. So with allopathic consultation, they'll just have a physical examination and they'll be done with the sign and symptom. But for
Yeah.
us, the behavior of the patient during an attack becomes important. So what
Yes.
he said was she becomes extremely clingy when she has this attack.
Clingy.
Yeah, she wants her husband just beside her.
Mm.
She will hold her husband's hand and she'll sit and she'll not allow him to move out at all. Okay?
Mm.
And one thing she does is She was in an AC room, okay, air conditioned room, yet she
Yes.
wanted continuous fanning very
Yes.
close to her mouth. She was having so much of air hunger. They were continuously fanning her, but she was not getting better. Even she was put on oxygen. Then also she was asking for continuous fanning. So here we are. We didn't require any further details. You can guess the remedy.
Well, I'm not sure. I'm not actually sure because I would think a carbo veg because of the air hunger. But was it something else because of
You're
the
right.
clean?
You're on
I'm
the
right.
right.
Okay.
Yeah, you're right.
All right.
Yeah, so
Good.
close
She
fanning.
lives. Yay. Okay.
Close fanning, you see, close
Yes.
fanning, air hunger, and near death situation. Carbon.
Yes.
Okay,
Yeah.
carbon lies between life and death, right?
That's
So,
right. Yes.
carbo veg, I started on 1M potency. I spoke to Dr. Suchi that I'm starting on this remedy. We'll see what happens later. You won't believe after 4 doses of carbo veg 1M, she was out of ICU. Not only out of ICU, she was back home and she was ready for a complete case taking.
Wow.
Okay,
That's
so
fantastic.
now carbo veg was just given as an acute. Further
Yes.
on, further on, we told that like whatever we have done, it was just a short period. We need to understand the patient completely so that the
Yes.
tendency goes off, and we need to give her a constitutional medicine.
Yeah, so let me just, for our audience, tell the difference between an acute remedy and a constitutional remedy. So the acute is just for the emergency situation to get her out of trouble, to get her out of ICU, to help her breathe. That's classic for like that life and death situation. And then the constitutional, that wasn't a deep case taking. That was just, okay, what's happening in this situation? That's the acute remedy. And then once you got her safe at home, she was stabilized, then you can look at all of her and see what's her the remedy she needs deeply at all levels of her being, and that would be the constitutional remedy. Okay.
Yes. Yes. So now came the point where we could really take her case. Okay.
Yeah.
So, like I said, it's not just the physical that is important, but also the emotion. So we started the case with her acute attack, and there she said, "Doctor, I'm so sensitive that moment my husband goes apart from me, okay, I will get this respiratory attack."
In other words,
Okay.
she gets the respiratory attack
Yes.
just when her husband is
Husband
not
is
with
away.
her.
And even the husband said that, doctor had there, back there, the RMOs over there gave me some medicine to get it from chemist. I just went down, and when she was ill upstairs, I was uncomfortable down.
Mm.
Okay,
Yeah.
so they had a different kind of a connection, both husband and wife. Okay, so I
Wow.
spoke to the wife. Tell me more about this. Okay, what do you mean by you cannot leave your husband? Then she noted that once her real sister's husband went to work, and while returning back home, he met with an accident and he died. She
Oh.
saw the plight of the sister as well as the kind of relation she shared with her husband brought her in fear that what if I lose my husband? I cannot imagine, this was a word, I cannot imagine departing from my husband.
Mm.
Okay, I saw for almost 3 months she didn't allow her husband to go to work.
Wow.
Okay, although the office was just half an hour distance.
Yes.
So she wouldn't allow. She will just hold on to her husband, saying, "I don't want to lose you." Okay.
Mm.
Then she said, the all her problem. The first, as I asked her, when did you get your first asthmatic attack? So she said she got it back when she just got married, and she was shifted from her mother's place to her husband's place in Bangalore, and she was separated from her parents and separated
Ah.
from her family.
That's when
So
her asthma began, when she had to
yes.
separate from her family when she got married.
So now you see in three different situations, we get a common theme of separation. She cannot
Yes.
tolerate separation. So husband said, just to keep her happy and satisfied, he moved her house very close to her office so that whenever she wanted, she could come and meet him. or he could come and meet her in case of emergency or whatever. So all
Wow.
these wives, they have become so connected. Husband says, I can't imagine my life without her, and wife says, I cannot imagine life without him. So we are just one, and this was the gesture she made. Okay, we are
Wow.
completely connected. So when he goes away, it's just like this. I can't imagine. Okay,
Wow.
so with this gesture, we asked her more about it. So she spoke about being apart and being separated, and more like a feeling like being inside a womb, but not exactly like a womb. Just she gave a picture like, okay, you feel protected, you feel safe. And then we went to very important aspect in the case taking, that is the dreams.
Yes.
Okay, so in her dreams, she said she's on the platform. Okay, she has boarded the train, whereas her husband is not.
Hmm.
Okay, and she's separating from her husband.
Yes.
Okay, so if you go back, we in homeopathy we have this reference work. Okay, a program in which we put a lot of homeopathic medical symptoms, which we call as rubrics. Okay, so that we can near to a remedy, which helps us in selecting one remedy out of so many remedies that we have. So in
Yes.
reference work, we put this rubric: dreams departing from family members. Okay,
So you
and
mean that symptom, dreams departing from family members, you
yes,
have in the homeopathy software, in
yes,
the homeopathy literature. I mean,
yes.
I know this, but I don't think all of our audience knows this.
Yes.
It's just so beautiful how very
And
specific we
that's
get.
actually the beauty of the science, where these symptoms, a conventional doctor will say, oh, what it is, it's just a part. Or nobody, even a normal human being will not relate, okay, okay, this is a part of me. But for us
Yes.
it becomes so very important. Okay.
Yes.
So with the help of this dream, we saw there was one remedy, okay, which could correlate to everything of this, okay, and the remedy was chocolate.
Chocolate.
Okay. Now, chocolate
Yes.
is a remedy from Malva's family,
Yes. Now,
plant family.
so this somebody has actually, just so for the audience, because it's a little bit unusual, someone actually made a homeopathic remedy from chocolate because they decided it was an important part of our culture,
Yeah.
and and a lot of people crave it. And what
Yes.
would happen if we made a remedy and tested it on homeopaths and see what can it cure, what will it cause, and that means what will it cure. And they looked at the dreams of the people who took the remedy, and they looked at all the things that they felt and all the things that happened in their imagination, and they learned, okay, this is what the theme of chocolate, this is what the energy of chocolate is about, and so we can use it for this kind of case. So what is the main theme of chocolate, would
Yes.
you say?
So this family, Malva's, is a family of nutrition line. Okay.
And this is the plant family,
Plant family,
Malvales, the plant
and
group.
yes, and they have all the nutritive plants. Okay. And the main theme that runs in this whole family is about love.
Love.
Okay, so the theme here is being attached and then being detached. So you are
Mm,
attached to a loved one and then you are detached. Okay, so
yes.
love sick, there is another rubric like love sick. So you will see most of the romantic movies, okay, where they
Yes.
talk a lot about being departed from the loved one, and being
Yes.
apart. Like in, I don't know if the American viewers must be knowing, but back in India we have a superstar named Shah Rukh Khan.
We don't know that star
Yeah,
so well.
yeah. So all his movies depict a theme of being separated from the loved one and then reuniting.
Reunited,
Yeah.
yes.
So
And
now,
it's
yes.
just something that Americans may be able to relate to is, what do you eat if you have heartbreak because your boyfriend or
Chocolate.
girlfriend broke up with you? You eat chocolate. That's because
Yeah,
of this
chocolate.
relationship.
Yes.
Yes.
And what do you give your girlfriend on the first date? Chocolate.
Chocolate. Or Valentine's Day. Here, Valentine's
Chocolate.
Day chocolate.
Yes.
Yes. It's all
So
about love and connecting.
yes, so it's all about love and connection. So in homeopathic literature, there is a remedy for love sick. Okay,
Yes.
and that
Yes.
remedy is Stelia euphoria. Okay.
Tilia euphoria. Now, is
Yeah.
there a connection between Tilia?
That they belong to the same family as chocolate.
Ah, they belong to the malvallies. It's
Yeah,
another
but
plant in
different.
the
Yeah,
same
but a
group.
different miasmatic background. So
Yeah.
now, if we talk about chocolate, when this remedy was proved by Dr. I think Dr. Shankaran himself had proved this remedy.
Yeah,
So
Dr. Jeremy Sher also.
yeah, Dr. Jeremy Sher also proved this remedy. So the main theme that came up in this remedy was that the dream that they got is a hedgehog, okay? Dream of an hedgehog, where suddenly now this animal nurtures the young one, okay? And
Yes.
when the young one grows up, it suddenly departs from the young one, okay?
Yeah, the hedgehog
So
just
sudden
suddenly
separation.
abandoned its. Yeah,
Yes. So the theme of chocolate is sudden separation. Okay.
sudden separation.
No, you are one with a person, and suddenly that person is gone away.
Mm.
Okay.
Just like this, just like her sister's husband, who was
Yes. You are
suddenly,
so one, and
suddenly.
then suddenly, and her fears that I am so one with my husband, and suddenly we'll be separated.
Yes.
So she says, my only dream, doctor, now is to die with my husband. So whenever
Ah,
my husband dies, I want to die on the same day.
wow.
Okay,
That's
so that amount of attachment and that need of not wanting to detach. Okay,
yes.
so and then hand gestures are also very specific of this and then this. Okay, you are
Yes.
attached and then you are detached.
So I think, that's something, is the type of homeopathy you and I have both studied, because I forgot to mention that I have studied at the other song in Mumbai where you work, and that's how I got
Yes,
to be friends with you, as um, that hand gestures that the patients will make, that the clients will make, will unconsciously show the energy of the remedy.
yes,
So her gestures were showing you the energy of that Malvalise plant group theme of connection and separation.
yes,
That's terrific. Yeah.
yes.
So
So, say.
no, you go tell the rest of the
Okay.
story.
So, on basis of this dream and the whole overall picture that we got, we gave her chocolate 1M. So, when she was discharged from the hospital, she was on nebulizers, she was on BiPAP machine
Yes.
continuously. But now she has given up all the BiPAP machines, all her nebulization, her need of oxygen. And the best part was, husband got a chance to move out. He started his office and job back.
Oh, terrific. So she is off of breathing machines. She is
Yes.
breathing on her own. She is much healthier, and
Yes,
he was
you
able to
know,
go back to work.
back to you know what? One of the incident I forgot to mention in a case. She said after she was discharged from the hospital, one day her husband had to go to buy her medicine. Okay,
Yes.
so for the 15 or half, it was just a half an hour time that he was going to be away. In a half an hour time, she was completely breathless.
Oh,
Like even oxygen, even the nebulization wouldn't help her at all. So that
wow.
was her desperate state that she couldn't leave her husband. And husband was like, I have left all my outside life, no friends, no
Mm,
nothing, just for her because I cannot go away from her. So
that's absolutely
even if
desperate.
from the bedroom he will go into the living room, she will go breathless. So they
Wow.
had different servants for different things so that husband and wife could just be together every time wherever she is. But
Wow. And
now, even if the husband is not around, she allows, she's okay, she's healthy, she's doing her routine work. And now they are traveling to Mumbai to meet Dr. Sujit on Friday.
oh, that is terrific. This has been so great. Thank you so much for sharing your stories, because, you're spreading hope.
Yes.
People don't understand that there's hope in these situations, that they can really reach for a healthier lifestyle, a healthier life, a stronger immune system, that they don't just have to resign themselves to a life of managing the problem with pharmaceutical drugs that kind of mask the problem or suppress the problem but don't ultimately heal it. And I want people to know that real healing is possible,
Yes.
even in things that are frightening to, and that we've learned to have fear of, like autoimmune disease, and cancer. I mean, we as a culture, as a society, we've learned to fear these things, but in homeopathy, you know, we just keep doing what we do of treating the individual, saying what is unique about this person, what are the patterns over their life, what led them to this place, and what needs to be cured, what needs to be treated here. And like you did, layer by layer with this lovely boy, you know, you created great health. So this is what's possible, and I want everybody to know it.
Yeah.
Yeah.
Surely.
Yeah. Thank you so much,
Thank you
Sadaf.
so much, Oonagh.
It's a great pleasure hanging out with you
Yes.
and getting to chat, and love sharing your stories. And I'd love to do it again sometime, because I know that you see that here homeopaths have, you know, I mean, you work so hard in India. I saw how hard you work in Mumbai.
Yes.
Homeopaths in India tend to work 6 days a week, 12-hour days. Maybe you go back for a half day on Sunday for some, you know, training seminar or something like that. Like, you work so much and you see so many clients. There are so many people in India with very little money. Homeopathy can help them a lot because
Yes.
you can, you know, it's inexpensive. And so there's just a lot of homeopathy that happens very quickly. You can see very many
Yes.
people. So I know you have so many beautiful stories, and I would love to have you back again for another
Sure.
interview. Thank you so much.
Most welcome, Oonagh.
Yeah.
Bye-bye. Nice talking to
Bye-bye.
you.
Nice talking
Bye-bye.
to you. Take care. Bye.
Bye.